Virginia Health System, Shannon Reilly. She's assistant professor in the Department of Neurology, and this is not our first introduction to Shannon. She's done some presentations for us in the past, and she just has a wonderful way of delivering some very, very good information, and that I think you will find useful. I want to remind everybody to please don't forget to fill out your evaluations, and you can leave them on the table. So thanks so much for doing that. So folks, we are getting ready to get started. That in the back there, I know it's exciting. I know you could talk to Dr. Arovich all day. He's awesome. We're going to have to bring him back, I think, right? yeah. But anyway, thank you all so much, and thanks for coming out today. We are going to do another drawing, and without further ado, I'm going to hand the mic over to Dr. Reilly.
Good afternoon, everybody. How's everybody doing?
Great.
Wonderful. I like the energy in the room. That's fantastic. So thank you so much, Ellen, for that wonderful introduction. I'm very excited to be here. Very excited that you all have all come together today to talk about dementia education. So I'm Dr. Shannon Reilly. I'm a neuropsychologist. I work at the University of Virginia, as Ellen mentioned. And as a neuropsychologist, what I do is individuals who are having troubles with their memory or their thinking, or whose loved ones think that they're having troubles with their memory or thinking, they come and see me and my team, and what we do, we have a conversation with them and with their loved ones about what they've noticed in terms of changes. We do a bunch of different tests with them that look at different areas of their thinking, and then we talk with them about what we find. You know, are these changes typical for them, or are they in fact going through mild cognitive impairment or dementia? And it doesn't stop there, just that initial evaluation. We also have a multidisciplinary follow-up clinic, because we know that this is a chronic disease, and we really appreciate the opportunity to follow people and help individuals and families from diagnosis until death. I think that's really important. And so this cause of mental health and wellness in older adults is very close to my heart. And I'm excited to talk with y'all today. Just as a show of hands, how many of you are healthcare providers working with individuals with dementia or their families? Okay, so a good number. And how many of you are caregivers yourselves? Okay, so a good number of those as well. Anybody want to self-identify as both? You're caring for somebody at home, and then you go to work and you care for others as well. Yeah, so a couple, so that's kind of double caregiving. So hopefully this talk will be extra helpful for you. Before we go ahead and get started, I don't have any disclosures, and I talked a lot about the Memory and Aging Care Clinic. We have a wonderful team, and our patients and their families inspire me every day. So very, very much appreciate them, and they help me want to learn more and then talk to others out in the community about mental health and wellness. So today, what we're going to be talking about, as a psychologist, I kind of take a developmental perspective on this. I want to talk about mental health challenges in older adults, but we don't want to just focus on the challenges. We want to talk about well-being, and not just surviving, but thriving as well in older adults generally. And then, given that this is a dementia care conference, talking about well-being for caregivers, for all of you out there who are caring for individuals, your loved ones with dementia or with mild cognitive impairment. So has anybody seen this before? This is Eric Erickson. He was a psychologist, and he, wild idea, he thought that development doesn't just end after the first 5 years of life, or the first 18 years of life, or even the first 25 years of life when the frontal lobe is fully developed. His perspective was that development and growth continues and occurs throughout the lifespan. And we could be here forever talking about all of these stages, but what I want to focus on today, just kind of briefly to set the tone for what we're going to be talking about, is these last two stages. So thinking about getting into older adulthood, and of course, 40 to 65, we're not quite there yet. And even those of you out there who are 75, 85 might say, I don't feel so much like an older adult. But we conceptualize these stages as, at each stage of life, each stage of development, people are kind of going through this crisis and this task. And so very early on, it's developing trust versus mistrust. As people get older, they're developing intimacy, and if they don't kind of move through that crisis of each developmental stage, they kind of end up with the negative aspect of it. So if you're not developing intimacy, whatever that might mean for you, be that a partner, friends, other loved ones, family members, joy in your work, you kind of come away from that period with a sense of isolation. And so at each stage, we want to be kind of on the left side and not on the right side. As people are moving through middle adulthood and older adulthood, it turns into less about kind of growing and developing, but more about kind of what is the legacy and passing on, and how generative somebody has been in their career, in their home life, transitioning into leadership roles and mentoring younger professionals or younger family members, so that there will be kind of a legacy, something to move to continue on after you kind of move out of that stage, or even after death. So developing at that stage really additional care and love for family members, and for even people with your work as well. So developing care, and then moving into age 65 and older, really thinking about reflecting back on life, developing wisdom, continuing to lead an important life, while also looking back on everything that you've done so far, taking stock, developing, hopefully, the goal is a sense of satisfaction and peace with your accomplishments and with the relationships that you've developed, rather than developing a sense of despair, which is not what we want to happen. So we're going to talk very briefly about kind of that aspect of despair, those mental health challenges that Dr. Ehrich kind of touched on in his last talk, and then I want to slide into talking about well-being as well. So we know that depression is common in the United States at any age. It's been increasing over the past couple decades. And I found this statistic in adults over 75, so not even over 65, up to 9.3% of adults 75 and older have clinically significant depression. And over a third additional individuals, so maybe they don't need clinical diagnosis for depression, but they're still feeling a sense of low mood, sadness, low motivation, potentially feeling a sense of guilt and burden. That's a lot of people. And particularly for older adults, depression tends to be underdiagnosed and undertreated or even untreated. And part of that reason is that specifically in older adults, depression doesn't always look like low mood, crying, feeling sad. It might instead show up as things that older adults might be experiencing for other reasons. So sleep problems, troubles getting to sleep, staying asleep, not feeling rested, feeling fatigued during the day, or having memory changes. Those can all be symptoms of depression that are actually more likely, they're more likely for depression to look like in older adults. But these symptoms, as we know, can be caused by a whole lot of other things as well. So it might be undiagnosed and untreated, even if the people themselves do recognize, or their loved one might recognize, you know what, there's some depression going on. There's still barriers to obtaining help. And for older adults, actually, some of the reasons for those barriers to obtaining help are similar to those for younger adults as well. So there's still a fear of stigma, unfortunately, for seeking out mental health services. And just having a lack of knowledge about where to go for that help, and what that help might look like, whether that is medication to treat depression, therapy or counseling, even kind of joining a support group, whatever that might be. But for older adults in particular, I think, I still deal with challenges with technology as well. But I think, I was taking a look at the literature, and for older adults in particular, engaging with telehealth services, particularly in the context of COVID and the pandemic, when a lot of things had to transition to, being via video, picking up your phone and talking to your counselor, that was kind of an additional barrier that older adults are having to navigate as well. So Dr. Arovich talked about this a little bit, but depression in older adults. And so we've got depression here. There are things that contribute to depression and things that can result from depression. And some of them are actually the same. So it's kind of this vicious cycle a little bit. So chronic health conditions, even things like diabetes, heart failure, other cardiovascular conditions, can contribute. Chronic pain can certainly contribute to a sense of depression. Cognitive impairment is both a contributor to and a result of developing depression. So even if we don't want to care about treating the depression itself for depression's sake, it's incredibly important for the sake of preserving cognitive and brain health as well. Endocrine disorders, so hypothyroidism can look like depression, can contribute to depression. So it's always very important if you start experiencing new onset symptoms of this, talk with your doctor, see if there's anything going on medically that could be contributing. Also, in thinking about older adulthood, social isolation is more common. And again, particularly in the context of COVID-19, which hopefully we're slowly but surely moving out of. But I know that here in clinic, these last few years have been really challenging for a lot of patients, a lot of families, probably a lot of y'all in this room. Thinking about those role changes, those stages of life that I just brought up, having potentially a loss of status in older adulthood. So being at the top of a company, being a leader at church, being, a head of an organization, and then retiring or transitioning out of that. That role change can result in a sense of a crisis of identity a little bit. And, who am I now? What's my worth now? Potentially. So contributing to a sense of depression. And, of course, history of depression. If you've had depression before, you're more likely to have it in the future. And thinking about, having depression, a lot of these same things can result from depression. Depression can be pretty disabling and can make it harder to function day to day, even harder than it already is. As I talked about, can cause cognitive decline and even dementia. And there's studies that it's been associated with mortality as well. So we can understand that it's really, really important to treat depression, and not only to treat depression, but to move toward thinking about well-being for everybody, but particularly for older adults who might be more likely, more at risk of this. And so thinking about, there's a lot of programs out there to support well-being in older adults. But first, I think it's really important to think about, what do the older adults themselves, what are they interested in? How do they think about their own well-being? Because I don't think it makes sense to start a program before you talk to the people themselves and say, how can I help you? What can I do for you? Versus kind of putting that on them yourselves. So in Finland, this focus research group talked with a bunch of older adults. Basically, they were wanting to start some programs supporting older adults in the community. And so they said, what is important to you all? What do you all want? And so these were kind of the main topics that they came up with. And we'll go through each of them. But relatedness, competence, autonomy, physical thriving, pleasure and stimulation, and security. Are any of these surprising to any of you that these came up as being the most important kind of well-being needs of older adults? Or this kind of makes sense? I know that a lot of these things are important to me as well, probably to a lot of people. And so I appreciate, though, in these types of studies that they put a label on what it is that we might all be thinking about, because you can only kind of do something about it once you've operationalized it, once you've named it and talked about it.
And what we'll talk about is that some of these well-being needs go really well together. Sometimes there's different activities, things you can do that can kind of get at multiple at once. But then at the same time, there's a couple of these that are sometimes can be in conflict with each other, and we'll talk about that as well. And so sometimes there's a trade-off between really moving towards one need and having to pull back from another one. So let's talk about relatedness. So having regular, intimate contact with people who care about you, rather than feeling lonely and uncared for. So that's kind of how they operationalize that. And so with each of these, I want to think about how can you, because it's not like we can achieve relatedness, right? We're always striving towards that, but we can think about how to work towards, how to move towards each of these well-being needs. And also thinking about what are some barriers that might get in the way of that, and how to potentially troubleshoot and problem solve that. So thinking about how to work toward relatedness, I think in some ways this is kind of the easiest one to think about, socializing with friends and family just informally, but also engaging in organized social activities, kind of like y'all are doing today, coming here and learning and talking together about a topic that's important to you and that you're passionate about. Going to church, engaging with your church community. I was reading some literature that there was this study that looked at a singing group, people coming together and doing a singing group for 6 months, and in fact engaging with that singing group improved quality of life, improved anxiety, and improved depression. And so go join your local choir. That's something that can help with your sense of well-being. Even things like creative writing groups, joining a book club, all these things can increase a sense of relatedness and improve well-being. But of course, there are some barriers to this for all of us. Again, I keep harping on this over the last couple of years, but the pandemic has really gotten in the way of our ability to relate to others, to physically be near our loved ones, having regular, intimate contact with them. But also particularly for older adults, there's a sense of a loss of loved ones sometimes. So that might be children moving away, developing their own lives elsewhere. Could be the loss of the deaths of a partner, of friends at that stage of life. And so there are these barriers to this important aspect of relatedness. But we can talk through different ways to move towards that. So thinking about, not just relatedness, but pleasure and stimulation. So feeling that you get plenty of enjoyment and pleasure in life rather than feeling bored and feeling understimulated. And so to work towards that, kind of whatever floats your boat, right? Whatever you enjoy doing in terms of hobbies, recreational activities. Sometimes people will come into the clinic and say, should I be doing a certain number of crossword puzzles? Should I do puzzles? What should I do to help my brain, to help myself feel better? And I tell them, I am not going to prescribe you a certain number of crossword puzzles to do every day. You go ahead and do what feels right. If you enjoy reading, go ahead and read regularly. If you like doing crafts or drawing, go ahead and do that. Whatever it is that gives you pleasure. That might be traveling as well. Again, could go along with that relatedness, joining with others to engage in organized activities around something that you enjoy. But there's also a sense of sexual wellness as well, right? That's important for older adults too. And I think one of the barriers to this is avoidance of talking about sexual challenges with healthcare providers, both on the part of the individuals themselves and the healthcare providers not wanting to offend anybody. But it is an important aspect of well-being that I want to make sure that we're aware of. Another, I think, more common barrier is just transportation difficulties, particularly for older adults. If it's harder to drive at night, that you might have to be thinking about different ways to engage in these enjoyable and pleasurable activities. Thinking about physical thriving, so feeling that your body is healthy and well taken care of. I think this comes up a whole lot as we talk about it in clinics so much. Physical exercise is one of the things that we know from the research that most consistently is associated not just with increased mood, but actually improved cognitive health and brain health. I don't know about y'all here around here, but we have Silver Sneakers over in Charlottesville. I think there's a lot of different exercise groups that, again, get at that relatedness aspect as well. Walking in nature, so spending time outside, that's certainly a way to increase physical thriving. And making healthy meals, taking the time either on your own or with somebody else to cook, if that's enjoyable for you, and make something that's good, that nourishes your body. But something that we see, particularly for older adults, is that physical limitations can get in the way of that. You know, you're always hearing your doctors say 3 times a week, at least 30 minutes, get that heart rate up, do physical exercise. It's really, really, really important. And sometimes people do have physical limitations or health conditions that make that really difficult, and there can be a lack of information or knowledge about, you know, I do have chronic pain, I did have a hip replacement or a knee replacement, what do I do now? You're telling me to exercise, but what should that look like individually for me? And so something that can really help, actually, is talking with a personal trainer, talking with even with your primary care doctor to say, you know, what is feasible for me? I want to exercise. We've talked about kind of the motivation to maintain that today, that's so important. And so increasing information about how to do that safely and feasibly for you all, I think is really, really important. And also stimulating options. So I think sometimes people recommend, you know, things like chair yoga and things like that. That might be so on somebody's radar as something that they want to do. For others, that might not be something that they're interested. So again, in order to do things sustainably, it's important to find the thing that works for you and then move forward with that. But I think physical thriving is a really, really important one. Nourishing our physical body, but also our spiritual body as well. Confidence is another one. So feeling capable and effective in your actions. I think that's important for all of us. And wanting that sense of confidence can actually move people towards a preference for engaging in familiar activities or things that they've already mastered. Because they don't want to lose face. And for some, what that might include is things like technology. So as things have moved towards, you know, automatic payments for bills and things like that, or talking with the grandkids on Zoom, sometimes that can be really challenging. And so I think it's important to talk with others about that. And try to figure out how to learn new skills that might be harder for you. And so I know that there are a lot of classes out there that are online. The OLLI classes I've heard are I think it's Osher Lifelong Learning Institute, and they have a lot of interesting classes that you can learn a new skill, learn something new, and that's really good as well for extending your brain. So building confidence in a new area and not just focusing on what's already familiar for you. Autonomy is another one. So kind of along with confidence, autonomy, feeling that you and not external forces or pressures are the cause of your own actions, kind of you're in charge of your own life. You have independence in decision making. And so working towards that, we're using and engaging in things that are affordable for you, convenient for you, voluntary. A barrier to this autonomy that we often come up against is cognitive decline. And so for individuals who do have dementia, there's always this balance between autonomy and safety, particularly as things progress. And so something that I talk about is, you know, communicating about your needs. Really, I put this in bold. I talk about this with everybody, advanced care planning. So for yourselves, for your loved ones with dementia, for your patients who have dementia, talk early and often about their wishes, about, you know, what they want for themselves now and in the future, especially as things do progress. So that they can engage in some shared decision making now and have some autonomy and ability to engage in those decisions now, even if it gets harder for them later. Security. I think this is at the bottom of Maslow's hierarchy of needs, so feeling safe and in control of your life rather than uncertain and threatened by your circumstances. And so working towards security and safety, just kind of developing consistent daily routines for yourself. I know for individuals with dementia, that's particularly important. And so for caregivers as well, not trying to rock the boat too much day to day. But even things like switching your timeline, so engaging in activities during the day when you might feel safer going out than engaging in activities at night. Letting others know where you're going if you're going out. So really trying to maintain that sense of security. Cognitive decline is another barrier for this. If you're having memory troubles and you know that there's something coming up, you know that you're supposed to go to an appointment, or you know that your kids are coming to visit but you don't know when, that creates a sense of unpredictability and insecurity, which can lead to those repetitive questions that we know can often come up. And so facilitating security and a sense of security, thinking about for yourself, your loved one, and for your patients and their families, a stable living environment that matches their current needs and potentially their future needs. So even thinking about, you know, I live in a house that has multiple levels of stairs. Is that, but I just had my hip replaced or something like that. Is that really meeting my future needs, or is that creating a sense of insecurity for me? So really trying to develop that stable living environment and developing and maintaining close relationships for that sense of social security as well. And so I really liked this framework of thinking about these different well-being needs, and I came up with just a couple here to boost well-being and kind of put multiple of these together for older adults, for individuals with dementia, caregivers, but I think this is helpful for anybody and everybody. I've heard this before, that walking and talking in nature with a good friend and talking about your problems, that kind of hits all the areas there, right? You're getting relatedness, physical thriving, you're getting out in the community and engaging with nature. Again, we just talked about choosing a living situation with built-in socialization and activities that might be there. Deciding to learn a new skill with friends or family, so getting at a sense of competence, autonomy, and deciding to do that, and relatedness. And planning for your future and helping to plan for your loved one's future and communicating your wants and needs with your loved ones so that they know that your autonomy will be respected when the time comes when decision needs to be made. So that's just kind of for older adults in general, but we are particularly here to talk about mental health and wellness of dementia caregivers, as some of you are, and as all of you I know care for and care with. So just caregiving by the numbers, you all have seen this before. There are a lot of individuals out in the US with dementia and with Alzheimer's disease in particular, the most common type of dementia. Along with that, there are a lot of caregivers here in the US who are giving a lot of hours of care and a lot of unpaid hours of work. They are investing, you all are investing a lot of time, energy, passion, and love into caring for individuals with dementia. And there's a lot of reward that comes with that, and we'll talk about that, but there's a lot of challenges that come with that as well. And so recent studies suggest that over 1/3 of caregivers have high emotional stress or caregiver burden as well, or both. Some have both, some have just one, but clinically significant depression. And so being a caregiver is also a risk factor for developing depression. So it's really, really important for caregivers to focus on and prioritize their mental health and well-being, which I know is really, really hard to do. And so we'll talk about how to do that. But challenges specific to caregiver well-being. So here I included some of these different well-being needs that we've already talked about. And actually here, what I have in a lot of these are different statements that are on a measure that I give sometimes called the Zaret Burden Interview. So it's a measure of caregiver burden. And so they are things that caregivers often will endorse that directly contradict these well-being needs that we just talked about that are so important. And so sometimes caregivers will feel like, I don't know if any of y'all have felt like this before, but you don't have enough time for yourself. You don't have enough time for your social life. Your social life has suffered, and you're not as able to have those relationships that are so important to you with your friends and family members. You might feel angry, stressed, or strained around your relative who has dementia or your loved one who has dementia. That's directly in contradiction to this important multiple of these well-being needs that we talked about: relatedness, close, intimate contact with loved ones, engaging in pleasurable and stimulating activities, and thriving physically. Thinking about competence, I hear a lot of this feeling uncertain about what to do about their relative, feeling like I should be doing more and I could be doing a better job. So not feeling a sense of competence, mastery in this potentially new job of caregiving that you might not have felt you had a whole lot of choice in taking over. So over half of individuals in a recent survey said, I didn't feel like I had a choice when I stepped into this role of caregiving. And so not a lot of autonomy in that. And not feeling like there's as much privacy, or that you might have feel like a loss of a sense of control in your life related to caregiving responsibilities. And of course, dementia, it is an unpredictable disease process, particularly given the heterogeneity. It can look different in different types of dementia at different stages as it progresses. And so there can be a lot of unpredictability and insecurity in caring for somebody with dementia. I want to talk a little bit and, contextualize and normalize mental health through the caregiving process. And so early on, I took a look at some qualitative studies. So researchers who got together with caregivers and had long, in-depth conversations about how is this process going for you early on? How is your mental health early in this stage of caregiving? And they came away with these themes that caregivers were feeling, and this is particularly spousal caregivers, so caring for a partner, feeling a sense of frustration and guilt with this new process that's happening to their loved one, and living with a sense of loss, that this wasn't what they expected. A sense that everything is on my shoulders. My loved one now with this new diagnosis, I don't know that they're going to be able to do what they used to be able to do. So now I am going to take that on in addition to doing all the things that I was doing before. So there's a sense of having to adopt new strategies to manage these changes. Hoping against hope that, maybe something that the doctors do can help early on, not having a sense yet as to whether this might be something that's neurodegenerative that might not be able to. Insecurity there. And so focusing on, we're going to get through today, and we are focusing on today while also thinking about adjusting for future expectations. What is the future going to look like while trying to stay in the present? And something that's interesting, thinking about grief through this process of dementia. Grief, we can think about grief with a loss, grief when somebody dies. With dementia, it's not quite like that. Dementia is a long process, a process that's ever changing. And so there's anticipatory grief with dementia, which is real and just as real as grief when somebody dies. And in fact, there's research that having this anticipatory grief as you're going through the process of dementia with your loved one can actually make that grief process better after the death of your loved one, can lessen that grief later on. And through the process of dementia, the most common types of caregivers are spouses or partners and adult children. And what the research tells us is that their grief, their feelings throughout that process, they're quantitatively similar, but they're qualitatively different. And so they have a different sense of, they experience the caregiving process differently. And so early on, there's kind of a difference here, that spouses who may be more like, here's maybe some, they can recognize this a little bit. So earlier on, spouses, partners who might have been around us the whole time, now that they have a diagnosis, there's maybe a little bit of easier acceptance and openness to the idea. Focused on the present and potentially even a little bit more able to be realistic about the future. Okay, this is something that we're going through and we're going to walk this road and I can take it going forward. But there's also a sense of a loss of companionship there with your partner. That's a little bit closer to home than even with an adult child. Who kind of in contrast, early on it looks pretty different with dementia for an adult child caring for a parent. So rather than that easier acceptance, there tends to be a denial. No, Dad's doing just fine. He's just a typical 79-year-old. There's nothing going on, Mom, it's fine. A loss of freedom. Shoot, okay, so you need me to come and take Dad somewhere, or you need me to cook more meals for Mom because she's not able to do that as much anymore. And they're not even thinking about the future. They're like often in the sandwich generation, so having to care for young kids and then having to help and care for parents as well. I'm just focused on getting through today. So it looks qualitatively pretty different early on in the process for kids and for partners. As we're moving more toward the middle stage of dementia, the spouses, the partners have already been open to this for a little while. There's a bit of a smoother transition to that middle stage. And rather than focused on the loss of companionship, so that sense of one-on-one personal, at the same stage, on the same page in that early stage, there's more of a sense of aloneness and loneliness in this middle stage as your loved one progresses. A little bit more sadness, a sense of compassion and empathy for your loved one. Since the adult child, earlier on, things are doing okay. I'm just going to put that over here, not worry about it until something's really, really, really bad. There's a rapid transition to reality that Mom or Dad, my parent, wow, this is a big loss. I did not see this one coming because there was this avoidance or denial earlier on. There can be a lot of frustration and anger and guilt, so kind of some more outwardly negative emotions there versus the spouse or the partner tends to be a little bit more introspective in this middle stage. As things progress to late stage of dementia, what we see again, I think it kind of comes a little bit closer together, I would say, at this later stage, but again, still distinct, still qualitatively different experience. The spouse or the partner in this late stage, having gone through this sense of anticipatory grief, it's like, okay, wow, we are at the later stages of dementia. End of life is potentially near. There's some uncertainty and confusion, even more sense of feeling alone. As we move toward this mid to late stage, there's questions that come up around, are we aging in place? Is my loved one going to stay at home and maybe we'll bring in some extra care? Or does it make more sense to transition to an assisted living facility? And so if that's the decision, regardless of where that help comes from, whether it's in the home or elsewhere, there's a little bit of a sense for both of these family members of burden eased with additional long-term care, additional support. And the adult child feels a bit of a sense, here they were in kind of the anger stage and now they've moved into a bit more of the sadness, a bit more of the kind of traditional grief. And they might be feeling a sense of, death will be a relief for Mom or Dad. Whereas spouse, partner is not quite sure. They're not quite ready to have that certainty about that. So here we see, I thought that this was a really interesting way to kind of move through the process and think about this, what this might look like for loved ones coming in into clinic for help, thinking about not just the individual with dementia, but the whole family. And how is the spouse or partner doing? How is the son or daughter doing, or child? Thinking about end of life and how the caregiver is doing, and how to support the caregiver at that time. That's really, really important. And it might be a time where others are pulling away. They don't know what to do. There is a sense of discomfort there. And so this can be kind of a way, there's a desire for genuine emotional support from the caregiver at that point, even as people aren't quite sure how to give that support. We talked about the decisions about facility placement and end of life. Does it make sense? How should my loved ones kind of remaining years, what should that look like? What would we want for them? And if with hopefully some advanced care planning came earlier on, you would know what your loved one wants and be able to honor that. And there's a sense of trusting and relinquishing that care to somebody else. And so not that sense of caregiver burden and stress goes away, but that it transitions a little bit as you get additional help from others. There can be a sense of quasi-widowhood with this anticipatory grief that my loved one isn't quite the same as they were, but they're still here, but they're not quite the same. And then finally anticipating and experiencing their loved one's death, and then reestablishing what does life look like after this. I've been a caregiver for so long, I went through this whole stage, and who am I now after my loved one has died, particularly for a spouse or a partner, I think. And so I think there's a lot of challenging emotions that can come with caregiving and when thinking about this unpredictable process, but it's not all negative, it's not all bad. There's a lot of resilience in caregiving. So a large percentage really find, not everybody, but a lot of people find meaning and a sense of purpose in the caregiving role. There's a sense of altruism there and feeling satisfaction, feeling competence, feeling like they're mastering something as they're going through this process and navigating the challenges that come up in dementia. A sense of self-efficacy and inner strength, I can do this, I am caring for my loved one. And the sense of relatedness that comes from it, strengthening the bond with your loved one who has dementia, whether it's your partner, friend, parent. And with others as well going through this process. And in the trauma of caregiving, which it can sometimes be, there's growth in that as well. So the sense of resilience in caregiving too. There's a lot of emotions that go on with caregiving and what would help. And what we know is that person-centered responsive care is really, really important. And what that care looks like is, care for the caregiver, as a caregiver, and care for the caregiver as an independent person. They are not just caregivers. You all are not just caregivers. You are the same person that you were before you were a caregiver, and you need support and help for things going on outside of that as well. And so it's really important when trying to help caregivers and recognizing for yourself you need help as a caregiver, but you need help and you need to be able to be your own person outside of the caregiving role as well. And that's emotional things, but also kind of logistical things that come along with the process of dementia too. Feeling comfortable talking with doctors about how to navigate different challenges that come up. And so what's going to be really important in taking that person-centered role and person-centered ideals is promoting these resilience factors, promoting self-efficacy, a sense that you can do this, promoting these healthy living behaviors that build this physical thriving, this relatedness, this confidence, and prioritizing mental health. But you might say, Shannon, how the heck am I supposed to do this when my loved one is, I can't leave him or her alone anymore. I don't feel safe. Or I just cannot get any sleep because I am worried all night long about my loved one, about my dad, my mom, my partner. And so that's where respite comes in. Respite can be a really good answer. And respite can look different. For different stages, different days. Could be a friend or family member come in and just sit in with your loved one, with mom or dad, or with your spouse or partner, so that you can go out to lunch, or go get your hair done, or go to a movie with a friend. It might be having a paid caregiver come on a regular basis, so that you can get some time to do the grocery shopping every week and just get out, run errands, or go do something a little bit more fun. It might be a recreation and enrichment program, so an adult day program, but focus more on the enrichment of the people themselves, developing their own sense of relatedness. And sometimes it might look like wanting somebody to, or wanting your loved one either to stay home with somebody overnight or to go to respite services for an extended period so that you can go get a bit of a vacation. Because again, you are still the person that you were before you were a caregiver. You need some time off, and that is okay, and that is important. many see the benefit of engaging respite services, whether, we'll spend some time during the day in a supervised, enjoyable, active situation that they can engage with other people. It reduces caregiver depression. It reduces caregiver stress. They can spend less time addressing the needs and behaviors of their loved one with dementia, and so they might be able to more sustainably have higher quality ability to engage in that. It's less kind of taxing over time. They can spend more time on their own work-related activities, and so other responsibilities that are unrelated to caregiving. And it actually helps the individual with dementia as well. It improves their behavior and their sleep on the days that they attend that program. It's cost-effective having your loved one attend a day program with others, in addition to or instead of, having somebody come into the home. And if you can have that time off and have your loved one spend some time somewhere during the day where you know that they're safe and they're having a good time, it can delay the sense that you feel like, or that the caregiver feels like, if that's not you, that, you know what, I just can't do this anymore. I actually need to transition to something like an assisted living facility for my loved one and for myself. And so respite is really important because it can allow time and space for relatedness, confidence, autonomy, physical thriving, pleasure, enjoying, engaging in stimulating activities, and feeling a sense of security now and in the future. And so I encourage you all as caregivers and individuals working with caregivers to really emphasize the importance of this. Because caregivers can only care for their loved one as well as they are caring for themselves in a sustainable fashion. And so being able to take time and engage in these activities is really, really important. So I appreciate you all listening to me and engaging in this topic. I know that it can be challenging sometimes to talk about, but some things that I think that we covered are that it's important to promote generativity and a sense of integrity in older adulthood, just in general. And that older adulthood and caregiving in particular can confer a sense of risk. There's a risk of increased depression, but there's also opportunities for resilience too, a sense of finding meaning, satisfaction, developing bonds. We talked about today steps to increase a sense of well-being for yourselves and for your loved ones, and also how to be able to find the time and space to be able to do that. So relying on others, engaging others to support you because you are not doing this alone. And I'm happy to take any questions or any comments.
Okay.
Yeah.
So now that we're sort of coming out of COVID and the adult day programs are opening again, we saw so much deterioration in function of folks being at home for a couple of years. Do you believe that, based on what you do you believe that we can sort of regain some of that, or how do you see that playing out?
Yeah, that's a really good question, and I think it's a bit of a complicated answer because depression can come along with this, right? And so I think that absolutely with the increased social isolation, with not having as much cognitive enrichment, going out and doing things for the last 2.5, 3 years, there has probably been some underlying disease progression that we can't really roll back the clock on. But that being said, I think to the extent that it's depression, decreased alertness, I think that being able to get out in the community and do things again with loved ones can decrease that sense of depression. And I know that for individuals with dementia, when they are exercising, when they're socially engaged, when they're doing these things, in that moment they're able to be more alert and kind of feeling more on top of it. And so I think even with underlying disease progression, there's an opportunity for them to kind of show what they know more, be at the top of their game, versus maybe they haven't been able to be through the pandemic when they've had to stay home.
Absolutely. Thank you.
Yeah. Yeah, go ahead.
What does your office there at UVA do? Are you all seeing patients, doing research? What's your...
Yeah, both of those things, yeah. So I'm primarily a clinician, and so we do a lot of initial evaluations for people who have questions about, is this dementia, noticing changes for older adults in particular, or, if somebody's had a brain tumor or a stroke or something like that, some type of medical event, we'll evaluate them and say, this is what's going on and this is what to do about it, and connect them with other services. And if it does, and sometimes we'll kind of follow people over time and say, we saw you 2 years ago, come on back now, and we can actually compare you to yourself and see if there have been changes. So absolutely, we have a clinical group who we see, and we often see them going forward with their families in that follow-up clinic, where we have us as neuropsychologists, neurologists, nurse practitioner, social worker, who all get together to help the patients and their families. But yes, absolutely, we're still doing research as well I actually have a caregiving program that I'm wrapping up right now, and so going to be doing a little bit of research on that. And we have a lot of stuff going on in the clinic with the different providers, yeah.
That's cool.
Yeah, go ahead.
This is kind of out there.
Sure.
Do you know of any studies with using CBD to treat dementia?
Yeah, that's a good question. I don't know of any in particular, and I feel like I would want some good randomized controlled trials on that. So I just haven't seen the evidence on that yet. But I am sure there are people out there who are doing it, but I don't have a good answer for that today.
Okay, thank you.
Yeah.
I was looking to see anything close to home.
Yeah.
Something in Virginia or, yeah.
Yeah, not as far as I know, but that's a good question.
You can go, I think the Alzheimer's Association website, they have a trial match there. If you're looking for trials in your area, you can go to alz.org and you can get matched to clinical trials, different types in your area by putting in your zip code.
Yeah. Thanks so much for bringing that up, Ellen. And what I would also say, clinicaltrials.gov is a good website that you can visit, and that's kind of nationwide. It can match you up with research programs that are research studies that you're eligible for, or your loved one. And actually at UVA, we're part of the Virginia Alzheimer's Disease Center, and we are developing a registry of individuals who are interested in engaging in research, whether that is people with dementia themselves, their family members, even children, healthy children of individuals with dementia, and same thing, that they could be contacted if there are clinical trials or studies that come up that they might be eligible to participate in.
Probably can take one more question.
Yeah, go ahead.
Thank you. It was a great presentation. Could you give us a recommendation for the certified nurse assistants in a nursing home who have no respite care?
A very good question.
Your recommendations for them?
Yeah, that's a great question. And I think, and there's been so much turnover, I think, and so much staff shortage, especially in the pandemic, but I know even before that. And so I would honestly, I think it's really, really tough. And I would recommend these same types of things, taking time outside of work to engage in activities that recharge and restore you before you're going back into work. But I think that it's that's an area for caregiving programs that I think is a good next step. I've worked a lot with informal caregivers, so family and friends caring for individuals with dementia, but I recognize that CNAs often don't have a whole lot of experience, a whole lot of training working with individuals with dementia, and so not feeling that confidence being able to do that. And so I would hope in the future that I and other my colleagues can actually help CNAs and others like them. But I think same as any of us, taking time out to recharge and restore, and seeking out training on their own to the extent possible in working with people with dementia, but I know that that is so hard. And hopefully the institutions, the organizations can promote in-service trainings and really support them institutionally and not just have that be on their own. That's a great question.
Hey, Ellen, can I just say something about that?
Yes.
Yeah.
I was in an assisted living community, and during the pandemic, it was just so overwhelming
Yeah.
with all of us. So what we would do when we started our stand-up